Welcome to the Digital Health and Wearables series. Today I have another magnificent guest and leader for you. But before I go ahead, let me remind you to check all the previous content there, all the previous episodes, and also hit subscribe so you get all the great content every week. And today I have a great guest for you. We have Jennifer Bae. She's Executive Director of Global Innovation at the American College of Cardiology. Jennifer, how are you?
I'm very well today, and thank you so much, Joel, for having me.
Well, brilliant. Thank you so much for being in here. I'm very excited about our discussion. We have a topic we're going to discuss how digital health can help meet global healthcare capacity goals. And the first question that I have for you, Jennifer, is what are sustainable development goals? And also, how can we use frameworks such as these to think about bridging gaps in healthcare access?
Absolutely. So, sustainable development goals are one approach to how the international and global community are recognizing that, across many forests, so not just healthcare, but, the environment, et cetera, that there's room for improvement, quite honestly, for humanity. And so, of the 17 goals that were established about 10 years ago out of the United Nations, there is one goal, goal three, that is focused on healthcare. And specifically, Sustainable Development Goal 3.4 is focused on reducing the morbidity and mortality from non communicable diseases, which is where my organization's focus lies at the American College of Cardiology, by 30% by 2030. It's important to note that the goalposts have moved on that goal. So when the goal was originally articulated, it was 25 by 25, meaning let's try and cut this by a quarter by 2025. And then more recently, the group decided to give the world 5 extra years, but also, up that threshold to 30% reduction in morbidity and mortality. The other thing I might say, and this is just top of mind because I spent the morning in some meetings with the World Economic Forum, is that there are organizational or international structures, like Sustainable Development Goals, that organize countries, and folks from civil society and non-governmental organizations certainly participate in how we can gather resources and link initiatives to meet those goals. But there are other organizations that are also participating. So the World Economic Forum has a few initiatives, on global health innovation hubs, but also on a digital health action alliance, both of which are motivated by controlling the spiraling cost of healthcare, globally, and improving outcomes, because there is a shared recognition that there's not efficiency in the system. Um, you had asked me about digital health and how it could meet those goals. But let me stop here for just a moment and see if you had any questions about what I just said.
No, that's brilliant. Thank you so much for reflecting the national, the governing body's action plan, also highlighting the goal is extended in length, but also in capacity, which is great, more ambitious goal. But as you know, digital health is a big agenda, is a big push globally to do things more effectively, less cost effective, and everything. So please go ahead and develop more on the frameworks on digital health or anything else on the great work that you're already doing.
Yeah. Well, thank you. So, I think to meet these goals, quite honestly, in healthcare, again, it's going to take a multifaceted approach. And we'll put to the side all the really important policy and other economic programs that are taking place under this rubric. Things about decreasing tobacco use, and the use of other harmful substances, encouraging physical activity, and those kinds of things, and also things like universal health care, initiatives under the NCD Alliance to include people living with non-communicable diseases and any policies that are related to non-communicable disease control. All of that important policy work is certainly relevant in this space. But in my role in the American College of Cardiology, I straddle two programs. So I straddle our innovation program, which has been in existence since 2016, And I was part of the earliest days of that program, building it up, to have an opinion on what we have called the digital transformation of healthcare delivery. So we believe that healthcare is ripe for disruption, and that, quite honestly, it's essential because we are reaching a point where, and the pandemic exacerbated this problem, where there are not enough clinicians to care for the number of sick people in any given community for the most part, and also globally. And so we believe that if we can deploy digital health technologies thoughtfully, we can bridge access gaps. And it's the thoughtful part is incredibly important, because we need to have in mind the clinician end user as well as the patient end user of those technologies. But we also must build these technologies with an eye towards health equity and make sure that we do not exacerbate gaps between the haves and the have-nots, because we've now put technology in place. The opportunities are, and I'm going to borrow some language from my colleague Ami Bhatt, our current Chief Innovation Officer, who has said, quite rightly, I believe, that standard practice of medicine is we tell ourselves that we're doing a good job of managing patients with chronic conditions by seeing them once or twice a year for a condition that they have 365 days of the year. And so there's an opportunity in using digital health to have better attention to patients' condition. Now, better attention can result in overuse. So there's going to be some work that needs to be done to set sort of like the rules of the road for engaging with these technologies. But fundamentally, we believe that technologies that untether care, not decouple, but untether care from the hospital and clinic setting, can allow us to do a better job of keeping stable patients stable at home and flagging patients who need intervention for cardiovascular care, for hospital and clinic visits. And if we can tie that to scheduling, then we can free up space from the healthy folks to go on living their lives, and then allow room for the people who really need to be seen to get in. So we think the technologies that will drive this are things like virtual care. So it could include telehealth as an example of that, but an interaction with your clinician, same time, different location, whatever that means for you. And it could be telephone, it could be video, it could be a combination. Remote patient monitoring technologies. So technologies that allow us to both measure the physiological parameters of a given patient. So, in cardiology, again, it's things like heart rate, it can be weight, it can be gait analysis, it can be sleeping position and respiratory rate, but those kinds of things. In addition to what we call patient-reported outcomes measures. So how a patient is experiencing their day-to-day. And do they detect more fatigue or irritability or weight gain or any of the things that they might just sort of experience that aren't as easy to measure from a watch or a patch or any of those kinds of things that could be relevant for care. And then two other really important facets of this are we must have AI or machine learning algorithms involved in this, because what we have to avoid is the circumstance where an individual brings a printout from their Apple Watch to their next clinic meeting and says, "Hey doc, can you help me make sense of this stack of paper?" It's just not humanly possible. So we have to be able to detect the signal from the noise in the data that we're generating. And then the last piece is thinking about this with an eye towards care delivery. And I think this is a key part of what the college does on the ground. Through the innovation program, we work with a subset of technology companies to actually develop their solutions with an eye towards the patient and clinician and users, so that workflow is given adequate consideration. Because what we were finding when we stood up our program was that we had brilliant computer scientists and engineers programming for these solutions, but who had not come up in the healthcare system, which is very complex and nuanced. And fundamentally, the best solutions out there, however elegantly they're engineered, are going to be the things that solve a problem for clinicians on the ground. And so we can bring that insight. And then, the other piece is just making sure on the patient side that we can put in technologies that are supportive of reaching patients in the communities where they live and work. So here in the US, we have a relationship with a company called Dispatch Health. And they are a rig that can do hospital at home, but also urgent care visits at home. And so they bring these solutions with them, but they bring healthcare back to the home, which is where we all started, actually.
Brilliant, Jennifer. Thank you so much for sharing this amazing insight. How can technology be part of the solution here, which you already developed very nicely? Yeah, you mentioned several things. Rewinding back to one point, I think
Mm-hmm.
one thing that is always missing in healthcare is the educational piece. So
Yes.
broadening these agendas around educating people about being active. Sometimes it's very simple, but the educational piece is missing. But what you also mentioned now about artificial intelligence and wearables, smart patches, medical devices. I'm a big advocate of wearables. I actually wrote a piece around the combination of artificial intelligence and wearables will be the game changer, because now we come to a point that we have too much data, and we know the clinicians, they don't have the time to deal with the data, to scrutinize, to analyze. The reality, for example, in here in UK, if you're lucky to see a doctor, you might have a face-to-face consultation. It takes maybe 6 to 8 minutes if you're lucky. In 6 to 8 minutes is more about prescribing, diagnose the problem and prescribing. So that's the reality. So bringing more data or bringing more complexity sometimes doesn't help. So healthcare is facing a lot of multiple challenges. But you mentioned really extremely important things about how can digital health really help to drive better outcomes and make things simpler and more effective. Thank you so much. And the third and last question that I have for you is, what is the American College of Cardiology doing to be part of this solution?
Okay. So you surfaced a lot of really important things, and I was just scribbling a couple notes to myself so I could remember to say a few words. Let's talk about the word education that you raised first, and the opportunity for technologies to be deployed more in that clinic setting, in the confined space and time that clinicians have with patients and patients have with their doctors or their care provider. Because I think that this is a place, and it's going to take time. Let me emphasize that this is not an overnight solution. We have to be thinking about this in terms of progress, not perfection. There are a number of things that we're going to have to tackle along the way in terms of workflow, in terms of reimbursement. Certainly in the US, this is a big issue for adoption of healthcare, but fundamentally, the technology exists. And I believe that there will be a future world in my lifetime where when I go to see clinician, my clinician will have a single dashboard with the most salient points, physiological, behavioral, and other points that are relevant to me and my health and well-being and the condition that I'm being treated for in one place. And my hope is that if that doctor has that clear picture of what's happening to me as a patient, that doctor can come into my 8-minute encounter saying, okay, Jen, I see that we're doing really well on sleep, but I also see that your exercise is down and your blood pressure might be doing these things over time. And you mentioned that, you were feeling a little bit fatigued in the past 2 weeks, but I also saw you had a cold, and, all of these different things that are happening, where then the technology becomes just sort of a way of gathering information that right now clinicians have to go into 4+ windows at a minimum to get to, most commonly in the US. And then they're trying to write down in their system what's happening. And what happens is they're looking at their screen and they're not looking at the person in front of them. So the best technologies are the ones that are invisible, the ones that can be supportive. And Ami and I have written an article on collaborative intelligence, this concept of we need to be doing more to train clinicians, both practicing clinicians and clinicians that are in training, to embrace these technologies. And what I mean by that is we believe that folks in medicine should have the same level of understanding of the promise and limitations of machine learning algorithms that they do have for the underlying pathophysiology of a disease. So this algorithm has presented me with this insight. I, as a human user, can take or leave that insight, but I need to understand the context from which that insight was derived. And I need to be able to trust the data upon which that insight was produced, that that data has been given careful attention to bias and equity issues as well. So there's lots of work to do here in this imagined future state. But assuming that I have that as a clinician, this clinician that I'm seeing has this understanding, understands the insights, then what we can do is produce a bunch of background information that allows us to reestablish the human to human relationship between a clinician and a patient, because the technology is now producing information that allows the two humans to decide how we can best manage an individual's care and well-being. And so I think that the college itself, to answer your other question, I think we have responsibilities to train clinicians to be in this space. So we're doing a lot at our annual meetings. Our education team is doing a lot of work on simulations and training, but also we're launching a collaboration with OSO VR, which is an AR VR company that came out of orthopedics to train on procedures, and now they're interested in growing into cardiovascular care. And so our team will be working with them to put out, OSO VR, ACC, cardiovascular, literally procedural training. And so I think there's a lot that could be done in this space. And then outside the US, the other part of my role is I work on our global programs. And so in global programmatic work, I think what we're seeing, not just in low and middle income countries, I actually think that this is a global phenomenon, but certainly there's special attention paid to low and middle income countries, that we can do a lot of work using technology to expand healthcare access. In the spring, I was up at the UN General Assembly on a panel, and one of my co-panelists was from this group called AMREF, and she was briefing us. They're a digital health-enabled delivery system operating in East Africa, but with sort of relationships across the continent. They have created a training system for their frontline healthcare workers where they started with a needs assessment for what do we need to know, have our healthcare workers know in the field, created a digital-based training platform on your phone to get these folks up to a certain level of capacity. And then they use the phone, support it as a supportive sort of tool in visiting the families that are under their care in the villages and the counties and districts that they go to. And then they can also use that to network with each other to talk about, I'd like to consult you on the specific case that I saw. And so I think that sort of end-to-end thoughtfulness of, clinicians at various different levels, frontline healthcare worker is going to have a different level of training, certainly than a cardiovascular specialist, but nonetheless, the power of being really thoughtful about how we can use technology in training and then how to actually support care in action is just an extraordinary example in my mind. And I think that the college, sorry, I almost forgot to answer your question, has a mission-aligned purpose and a long track record of doing education outside of the US with cardiovascular specialists. And we are intentionally pursuing opportunities to educate clinicians in countries outside of the US on things like, telehealth adoption that we can use to adopt, more access. And we have some materials already available to our members for, getting started in telehealth, for example. We have a series called Innovation in Action that is for clinicians who want to be more digitally forward in the practice of medicine. And so we have a telehealth workbook that came out of the pandemic. We have point of care ultrasound and care at home in progress. And we're working on how we can present something meaningful in remote patient monitoring because it's an enormous topic. And so we'll have to find a creative way to chunk that up in a way that's meaningful so that we can get these insights out to folks who want to use these technologies but don't know how to get started.
Brilliant. Jennifer, thank you so much for this amazing insight. You said in your own words that is so much happening, but so much to be done. But you are certainly pushing these agendas forward and raising the awareness, working on several things at the same time, the educational piece, and helping, of course, clinicians to have better access, more information, better education around the digital agendas. The last thing that I have for you is not a question as such. I finish all my episodes by asking for 1 minute of fame. You can mention anything: personal achievements, your work, family life, anything whatsoever. Shout out to colleagues. To round up the episode, over to you. 1 minute of fame.
1 minute of fame. So this is something that I'm very proud of. Well, let's stay on topic. I think I was given a wonderful opportunity in the earliest days of our program to create something that was, new to the college. And the American College of Cardiology is, a leader in digital health technology and innovation as medical professional societies go. And so to be able to be a part of analyzing this space, identifying the areas of greatest common interest. So focusing on healthcare delivery and technologies that are supportive of healthcare delivery to take care of clinicians and patients, has been really sort of a great honor. And it's been wonderful to see how far we've come, but also highly motivating to see how far we have to go. As an individual, I'm really attracted to roles that have a lot of impact. And I think I'm just really fortunate to be able to be in a place where I can make a difference.
Brilliant. Jennifer, thank you so much. Thank you for your time, these magnificent insights, your expertise, and the amazing work and impactful at the American College of Cardiology. Thank you for accepting my invite and being in here.
Joelle, wonderful to chat with you today. And thank you so much for having me.
Brilliant. I'm gonna round up now. To all our viewers and listeners, I'm gonna post Jennifer's socials in here. Connect with her on LinkedIn. Ask her questions about brilliant work at the American College of Cardiology, and also remind you to subscribe to the channel. And I'll see you all next week.